My name is Alysia Parker Stevens, and I'm a public health nurse at the Fairfax County Health Department. I am a person who likes to take care of other people, and that can occur in different ways, not just the medical, but also the social, emotional. And so when I think about my work in the field of nursing, I want to make sure that families have access to health care. That also means helping them to be an advocate for themselves, not just moms and babies, but also the family as a whole. So that can be quite a challenge, especially when you're dealing with different languages and cultures all in the same visit. A nurse who is interested in working in public health has to be flexible, has to be patient, and has to be open to learning new things all the time, no matter what it is, from language, culture, technology, working with families who have experienced intense trauma. And sometimes we have to think about our approach, your tone of voice, and meet families where they are while slowly building trust. There are times during the pandemic where I visited families by video calls. So I took the extra time to work with families before, a day or two before a visit, so that they can learn to download the app that is needed. I have always been intrigued by new life, growth and development of babies, pregnancy, the whole perinatal period. And when I think back of how did that come to be, I think about my own mom, who is a nurse, and there was a time when healthy babies spent time in a nursery in their own individual cribs, and you could see the babies. And so that's always amazed me, what goes on inside our bodies. When I first started this job, I knew before I accepted this job that I wanted to have a family, and I wanted to be able to be with my family and raise my children and spend time with my husband. So when I accepted this job, I knew that I would be able to have the flexibility with that. Nurses do change lives for the better. It's not always immediately seen, and because I've worked with the Fairfax County Health Department over a number of years, there are moms that come up to me, and they are happy to see me. If you are interested in the world of maternal child health, there are many options. Working at the bedside is not the only way. That's only one perspective of working in the world of maternal child health. Home visiting brings a huge perspective, and you can have a huge impact on a family. But there's also areas of policy that can be written that can also impact families, women, children, as well as the partners, the moms too. This job has worked really well with my family life, meshing in with my professional life, and it's really great to be able to enjoy my work while being able to have a life outside of work.